Re-engagement in HIV care is when a person who has interrupted their antiretroviral therapy, ART, returns to care. Differentiated re-engagement acknowledges that not everyone who's re-engaging has the same needs. How clients are managed at re-engagement is adapted depending on how long they've been out of care and what their clinical needs are when they return. Let's look at how differentiated re-engagement makes a difference for Gift and Lindiwe, who are re-engaging in care. Gift had been on ART for 5 years and had a suppressed viral load at his last visit. He had been receiving his ART in a healthcare worker-managed group at the clinic. The group met every 3 months and he received 3-month refills. Gift missed his last clinical appointment 5 weeks ago as he had to travel unexpectedly for work. When he returned to the clinic, Gift was seen by John, the nurse, and they discussed the importance of adherence and what to do if he has to travel for work in the future. John screened Gift for tuberculosis and found him to be clinically well. As he had been out of care for only 5 weeks, he did not need a CD4 count test. Gift was able to receive a 3-month refill and was referred straight back into his group to receive his refills. This enabled Gift to better adhere to the appointment schedule as he did not miss more work. For Gift, less frequent visits best support his long-term retention in care. Without differentiated re-engagement, Gift may have had to restart ART and be seen monthly at the clinic for the next 3 months. He would not have been able to re-enter his group until his next suppressed viral load test, taken 6 months after restarting ART. Gift would have struggled to adhere to his appointment schedule and he would have had to ask for time off work. Lindiwe had been on ART for 8 years. Her last viral load test showed that it was suppressed. Unfortunately, Lindiwe stopped her treatment when her life became busy. 2 years after stopping, her friends persuaded her to return to the clinic as she was losing weight and did not look well. On return, she was assessed by John, the nurse, and they discussed the importance of adherence to medication and lifelong treatment. John also performed all the routine baseline investigations he would for anyone starting ART, including CD4 count, given how long Lindiwe had been out of care. Lindiwe was diagnosed with advanced HIV disease, AHD, and needed to have the package of opportunistic infection, OI, screening test performed before she was restarted on ART. Once restarted on ART, Lindiwe had monthly clinical visits for the first 3 months because of the risk of OIs. These visits included intensive adherence counseling. Without differentiated re-engagement, Lindiwe may not have been offered the AHD screening package when returning to care, and may not have been followed up more frequently. For Nurse John, differentiated re-engagement has meant that he has more time to spend with people like Lindiwe, because clients like Gift do not need extra clinical appointments after they re-engage.